You've tuned in to the Locumstory Podcast, a place where we interview physicians, PAs, and NPs from all different specialties and backgrounds about their careers, tips for success, and of course, locum tenens. Learn more about locums at locumstory.com.
Hello, and welcome to another episode of the Locumstory Podcast. I'm Chase Johnson, and today we have the pleasure of speaking with Dr. Gary Drizin, a pulmonologist who began working locum tenens in semi-retirement. Dr. Drizin had planned to retire from his Pennsylvania-based private practice after nearly 38 years, but the 2020 pandemic changed his plans. Instead of retiring completely, Dr. Drizin decided to pursue locum tenens assignments as a way to ease into retirement and have a balance of work and free time. Dr. Drizin, thank you so much for joining us today.
Nice to be here with you, Chase.
Could you maybe start by telling us a little bit about your physician career and private practice before you made the transition to locums work?
Sure. I'm originally from suburban Philadelphia in a town called Plymouth Meeting. I grew up there, and actually my wife is from the same town. I ended up with my family. I paid for my education, and I worked in a local steel mill, Allenwood Steel, for 5 summers. And from working there, I got interested in employees with airway exposures and inhalant exposures, and also there were a lot of smokers, and I think that might have affected me as far as partially with my choice of specialty. I went to Temple Medical School, and after medical school, I did my residency at what was then Women's Medical School, then changed to Medical College of Pennsylvania, where I did my internship and residency, and then my pulmonary fellowship at Einstein Medical Center. I think I knew that I wanted to be involved in medicine and not surgery, and then after doing my residency, I was looking at different specialties. I wanted to know more about a specific area, and I also wanted to see about procedures that might interest me. And in addition to what I told you about my work experience, I decided on pulmonary medicine and finished my training at Einstein Medical Center in Philadelphia, now part of Jefferson. And it turned out that after I finished my training, there was an opening where I grew up at Montgomery Hospital in Norristown, originally an opportunity to work as an employee of the hospital. And I started there. It was always my intention to be in private practice. And there was another pulmonologist that was a member of a different internal medicine specialty group. And after 2 years, we joined to make our own Norristown Pulmonary Associates and left the umbrella of where we were before. And I did spend 38 years in that practice, originally Norristown Pulmonary Associates, and then we evolved to Criticality. We eventually had 8 physicians and about 16 employees in our practice. I did enjoy my time there. I enjoyed bronchoscopy. I enjoyed the age range of pulmonary medicine, the different diagnoses that I would come across, and the staff that I worked with in the office and the hospital. I ended up also having certain staff appointments. I was chairman of the Department of Pulmonary Medicine, then became chairman of medicine, and then I was on the board of the hospital. I had a special interest in medical ethics, and I was chairman of the ethics committee for over 10 years. And I also, by doing end-of-life care in pulmonary medicine, got interested in hospice, and I got boarded in hospice, and I was a medical director of the hospice for about 10 years. In the early 2000s, with changes in community care, and also it turns out that where I did my pulmonary fellowship, Einstein was looking for a better payer mix outside the Philadelphia city, and in the community where I was, they ended up building a hospital, and Montgomery Hospital ended up going into Einstein Montgomery, and I was involved in that transition and was chairman of medicine during that transition, and I also was on the board during that transition, so that was interesting as well. I guess, as you said, in 2020, I have 2 sons, and we enjoyed skiing, and we skied around many places, and we ended up getting a property in Vail, Colorado, and my wife, who was the principal of K3 and in the community where we lived, we intended to retire together in June of 2020, but because of the pandemic, in March of 2020, by that time, younger members of my practice, I had become an employee and they were the partners, and I was working in the office. And there was actually a question whether I was going to be laid off because of the pandemic and the issues with office practice. But it turned out I was able to do telehealth, and with the payroll protection plan, that actually kept me employed until June of 2020. My wife decided to stay another year, and in the Plymouth meeting because she didn't want to leave her teachers and students during the pandemic, but we'd already had our home developed in Vail, and I was committed to going there, and I did. We did travel together in July of 20, and we settled in here, and then she moved back in the fall for school. But because we were apart and because of their transition, and because I had gotten some calls, first by two members of the CHG group, first a representative of Weatherby and then a representative of Comp Health. And I guess I was attracted to the energy of the person from Comp Health. Her name is Alicia Turry. And she got me interested in applying to do locum tenens. I had never thought about doing locum tenens before because I was very happy with what I was doing. I think I got a couple calls during my 38 years in practice, and I said, why would anybody want to do this? But it turned out that when I moved to Vail and I had my interests in skiing and hiking and biking and being outside in a beautiful location, but I also enjoyed patient care, and rather than volunteering, I thought, why don't I do something that I'm trained to do and I enjoy doing because I enjoy patient care. That's how it started.
That's great. Well, you answered a handful of my questions I have. Can you maybe walk us through how you first navigated the situation that made you consider locums work? It sounds like there was a shift in employment was around that 2020 start time. Was that kind of was it serendipitous that you heard from both the Comp Health and Weatherby groups?
In a way it was, because it kind of got my mind thinking about it, especially with my wife now coming to me to Vail. And it turned out that as I was finishing the telehealth in my private practice, that's the time that I guess I did my applications. It turned out that actually after I moved to Vail, my first assignment was in Norfolk, Nebraska, and that lasted from July to September of 2020, and that was with a system called Faith Regional. So I think as I was ending my career in Pennsylvania, I was initiating that career with Comp Health, and it turned out it was a week a month, and they probably had, or soon after that, a full-time person coming because it ended at September, and it was probably during the credentialing process for that full-time person that I was useful to them. But I found out that, I ended up flying to Omaha. I got to see where Creighton was. I drove through the cornfields of Nebraska from Omaha to northeastern Nebraska where Norfolk was, and I enjoyed that. I enjoyed the patient population, and I enjoyed the staff that I worked with. And it was kind of remarkable because I thought it was very special at practicing where I grew up. I didn't necessarily start out seeing my peers, but I saw often relatives of my peers, and that was special. And people working in the community where I grew up was special. And seeing patients from where I worked at Allenwood Steel was special to me. But I found that the patients that I saw in Norfolk were great. They appreciated my care and the staff that I enjoyed with. So although the first assignment was short, it was a positive experience. I know you're working in a place for 38 years and then you work in a place for 3 months. It kind of is a little bit of a gut check and you wonder what's going to happen next. But it turned out that in the 4.5 years that I've been with Comp Health, I've had very short down periods between my different assignments.
Is that by choice? I assume that you want to stack it like that, or maybe walk us through that.
No, I think I was happy. I guess I was happy with that first assignment. I was happy with continuing to be a pulmonologist, to continue to be a physician. I think a significant part of my being is being a doctor, and patients tend to appreciate my communication at the time I spend with them. And I think with my patient, the time that I've had to spend with patients during my science with Comp Health, I've been able to have enough time to show them CAT scans, to go over breathing tests. Often they appreciate that communication. I've benefited from voice dictation with Dragon Medical, and often I've had them sit with me and they listen to me do dictations. And I think it's helpful to them to not only hear, but see what, if we give them a printout of different ways for them to understand what happened at the visit.
Amazing. That's great. Yeah, I think I want to focus a little bit on going from something you're used to for 38 years to, you mentioned a bit of a gut check going to your first assignment that was only a few months. Walk us through that transition. Like what were some of the changes or differences that you maybe weren't expecting that you saw from jumping into locum tenens work?
Well, Once I decided I wanted to do it, and I guess at my age and the difference with technology, health was really very helpful with the different staff members involved with either state credentialing or the assignment hospital credentialing with applications. So that kind of made it much easier for me to accomplish that goal. Living in Colorado and part of the Intermountain, well, the IMCC, there's different from being a member of the compact, where Colorado is part of a compact with other states in the compact. It makes it very much easier to get licensing in other states, and particularly when I started during the pandemic, and I think it made it also easier to get credentialing and with systems and with payers, that I was able to pretty much move sequentially from one assignment to another. So after I finished at Faith Regional in Nebraska, I quickly got assignment within a couple months in Saginaw, Michigan, with Confident System in Saginaw.
What are some of the criteria that you're looking for when how did you land on Nebraska? How did you land on Saginaw? Yeah, walk us through that.
I've benefited. I mentioned Alicia Turry. I've learned that with locum tenens, your representatives maybe move on to other positions. So I've learned to work with different representatives. First Alicia and then Sadie Morgan, and I've benefited recently from Brian Solier, and they've been very helpful with letting me know what opportunities are available. As far as I've enjoyed all my assignments, I think one of the most challenging things is traveling, and I've benefited from different travel specialists with helping me with itineraries. One shout out I'd give is to Charis Wayman, who of all the representatives I've worked with for a long time, she was helpful in most of my assignments with the traveling. And in many of the assignments, that was also the hardest part, because when I flew into Omaha, there would be an hour and a half drive to Norfolk, Nebraska. When I flew to Michigan to Detroit, there would be an hour and a half ride to Saginaw. I flew into Boise when I worked in Idaho at Twin Falls. Similarly, there was an hour and a half ride to Twin Falls. In my most recent assignment in Casper, Wyoming, that was different in that I flew right into where that was, and that was a positive. Sometimes with the traveling, living in Vail, I would have to get to Denver, and in the winter months there would be issues either flying from Vail Eagle to Denver or taking shuttles to Denver. And I can say in Casper as well, with the weather conditions there, I would be faced sometimes with delays or cancellations in flights. I have a memory of one Saturday before I would return home. There was a 10-hour delay before my flight was canceled from Casper to Denver. So that's part of the process that you have to learn to live with. But I can also say in 4.5 years with the different scheduling with my itinerary, I never missed a day of work. It was important to me to meet the commitments. I felt bad if there was patient scheduled for me on a Monday. I would want to do my best to make sure that I got there on time. I would say that traveling, although, that the specialists were very helpful, you always would wonder with the different weather conditions whether you'd get there on time. Once I got there, with the arrangements I had with rental cars, I often stayed in different Marriott properties. It was made easy for me to have those accommodations. So there was also learning different electronic medical records. I did in my private practice towards the end of my career. I was familiar with Cerner, but then there would be training in the different assignments with Epic that I would go back and forth, usually with Epic and Cerner, learning this. So that was a little bit of a challenge, but I was a little bit surprised with the help I got. I was able to manage my way through that.
That's great. So not knowing Epic when you first came in, that wasn't a deal breaker for some of the facilities, or it didn't sound like it was a deal breaker for you as well?
No, usually what I found, and I have the next assignment in Durango, Colorado, and I've been going through the process, and I had to take a test as far as my familiarity with Epic. I did Cerner in Casper, and it's going to be Epic again in Durango. And I have a course to take both in Epic and in Dragon Medical for voice dictation, and I'm going to be doing that before I start my assignment. And then there'll be a period of orientation once I get to Durango.
Great. So it sounds like they try and make it as seamless as possible, regardless.
I think that's true.
Yeah,
and
great.
So to be prepared when you start your patient care.
Excellent. I want to maybe ask you on your schedule itself. You said that you are relatively busy. Do you try and protect your ski season or anything like that, or time with the kids, time with the family? How does that work out with tracking
Most
down?
of my limits that were either a week a month or a week every 3 weeks.
Oh, great. Okay.
With the end of the pandemic, I think the government put a lot of financial support into hospital systems that ended after the pandemic. My last assignment in Casper was after the pandemic, pretty much. So I think that there were some financial restraints with the health systems. I think there were less opportunities in outpatient pulmonary. Remember, I'm doing outpatient pulmonary. I haven't been in the hospital or doing procedures. I did want to continue to work, and there was this opportunity in Casper. Casper was 2 weeks a month that I worked for over 12 months, and that was a little bit of a challenge, but it still left me 2 weeks a month for those other activities with family. And for example, in the last ski season, this past ski season, 56 days over 700,000 vertical.
Wow. Nice.
For many of not in Nebraska, but in Michigan and in Idaho and in Wyoming, when I would work 2 weeks or I'd have a weekend off between weeks working or a week off, several times, particularly in the nicer weather, my wife would come with me. In Michigan, we got to travel to Mackinac Island, to Traverse City, to Ann Arbor, closer to Saginaw, to a little German memory town called Frankenmuth. And we did that in Michigan. In Twin Falls, Idaho, we got to see Boise. We got to Sun Valley. And in Idaho as well, I don't want to misspeak, but in Idaho, we got to see also the Grand Tetons, to Cheyenne and to Laramie, where the University of Wyoming was. I should say I was never in these states where I've worked before. So yeah, I have traveled outside the country as well as different ski areas, but it was very enjoyable getting to learn a little bit about these other states and special places in the states.
That's excellent. It's nice that you can also explore that with your wife too. That's great.
Yeah, it was great.
Cool. Well, I love it. I want to talk about the IMLC, the Interstate Medical Licensure Compact. Can you talk about what that process looked like of getting that license, and it was difficult, easy? Maybe walk us through that.
Thanks. We spoke a little bit about it before, and I could go into more detail. And certain states are part of the compact that you mentioned. I think it's 26 states now and growing. And Colorado was one of the compact states, and it was a little bit more of an effort, but not too much, and I had help from CompHealth in getting my IMLC Colorado Compact license. And once I had that, I think all the states that I've worked in are part of the compact. One of the things that was amazing to me was, I told you that the first job in Nebraska was only about 3 months, and that took me to September or into October. And then the opportunity came up in Saginaw, and with the compact license and the pandemic, I think I heard about the job in December of 20, and I was working in January of 21. That was pretty amazing to me. And similarly, my experience has been by having the compact license in Colorado and working then after that in Idaho and in Wyoming, that I was able to pretty quickly, although a little bit longer than what happened in Saginaw, because it was more or less post-pandemic. It was really within 1 to 2 months that I was able to get not only the state licenses, but hospital credentialing.
Great. That's excellent. Durango's coming up for you as a new assignment. Is that the first locums assignment that you're taking in Colorado?
It is.
Excellent. I do know there's a good cohort of locum tenens physicians that will work relatively close to home. Durango is probably not close enough to Vail to call that a local locums assignment, if you will.
It is. It's a short flight, though. It's a 5.5-hour drive. So it is a flight to Denver and then a flight to Durango, but those are short flights. The longest flight I guess I had was to Detroit, and the other flights to Boise and to Casper weren't so far. And I guess that was something I have spoken to my representative. I did look at jobs where it were available, but I think that what was exposed to me was pretty much after Michigan flights that would be shorter.
Yeah, excellent. Yeah, that makes sense.
Also, a time zone difference, too, that it would be less time zones to have to deal with.
That's hard. Yeah, definitely. Did you find it ever intimidating to transition to some of these new assignments? It's like we talked about before, it seemed like it was relatively seamless. And yeah, I'm really impressed with your adaptability. But maybe is there anything that you call out explicitly of, maybe be mindful of this for a physician that's listening?
Well, I'm 73, so I guess I started doing this when I was 69, 70. And at my age that I learned technology as I went along, and I wouldn't describe myself as the most techie person. So I was a little bit surprised how I managed to go through the process with all the different applications. I've had to keep up with my continuing medical education as well. And I can say my wife has been impressed with my adaptability as well. I've been somewhat surprised, but I can say, having done it myself, it can be done.
Yeah, there you go. Good.
So I guess that would be my response. Continuing to learn to reorient myself to the different electronic medical records. I can say that everywhere I've worked, it's had voice dictation available to me, and to me, I can speak much quicker and in a manner that's much more adaptable than typing. So
Excellent.
I'm grateful for having that capability and opportunity.
Yeah, big time. You've touched on this a little bit. The question I have is, what sort of advice would you have to put your best foot forward in adapting to facilities and building rapport with the other staff? What I heard from you earlier was you've not missed a day of work since taking on locums. I think that speaks a lot to putting your best foot forward, but anything else that you'd explicitly call out in maybe setting yourself up for success on a new assignment?
In my prior leadership positions, I've learned the importance of teamwork. I can also say that it's something that I'm doing this because I enjoy doing it. I do feel it's a service, but I also enjoy patient care, and I enjoy the positive feedback that I get from patients. So when I enter a different assignment, it's really with that mindset. I've been very pleased with the different staff that I've worked with. In most all cases, they've been very accommodating when you're going into an assignment. Usually they have a need so that they're happy that you're there. I've always appreciated that. I've appreciated the fact that the help that I get often from the nurses and the med techs and the schedulers that I have, and going with that framework of teamwork. And with that, I think that I've always been appreciated wherever I've gone. And I've said that, I've told you previously that as much as I valued practicing where I grew up, I've enjoyed the positive experiences I've had in all my different assignments.
Amazing. That's great. You've been doing locums for several years now. What would you say is the number one aspect that you've enjoyed the most? I don't want to guess at it, at the freedom or the pay or whatever. I kind of want to hear it from you.
Well, I guess it's all those things. Living in Vail, Colorado, there was a question of trying to work in the local healthcare setting, but I felt that I've had more independence with the locums experience, and having the weeks off that I've had, either for the things that I enjoy in Vail, or in the past couple of years with my wife, we've been able to travel to different places. A couple Septembers ago, we were able to take a trip to southern Italy and Sicily, and last fall we took a cruise to the Greek islands. So this is really something that she enjoys, that I've been able to enjoy with her. I have family on the East Coast. We still have a condominium at the New Jersey shore, and I have a son that lives in New Jersey with my 2 grandchildren. So we get to travel and enjoy them. So I do have definite non-working time, and I think going forward, it'll be a week at a time rather than the 2 weeks that I did in Wyoming. So as long as, as I'm getting older, and I think it's a matter that I'll know when enough is enough. Yeah. But as long as I enjoy doing it and able to do it, I'm still able to enjoy my family and the other experiences that I've had. It's been a very positive experience with the locums work.
Excellent. That's great. To cap us off, maybe can you share any words of wisdom or advice for other late career physicians who are thinking about pursuing locum tenens work? I think you have such a great story. Anything else that we haven't touched on, or anything that you would explicitly call out for a potential colleague?
Well, but when I thought about retirement, and I thought what I'd do in retirement, a lot of people, retirement is great and that's what they want to do, and they go on to their different hobbies. I do have the hobbies that I spoke about with hiking and biking and skiing. Recently had a back surgery, so I'm recovering from that and hopefully able to continue to do all those things that I enjoy. But one of the things that I truly value is being a physician and caring for patients. If somebody in their later years, if that's something that they value, I can tell them that they can still have time to do the things that they enjoy, but still get the positive feedback of patient care.
Lovely. That's great. This is perfect. Well, Dr. Drizin, thank you so much for joining us on the podcast. We appreciate your time and hearing about your locum tenens experience today.
Thank you very much, Chase. I enjoyed talking with you.
This has been the Locum Story Podcast. To learn more about locum tenens and find additional provider stories, visit locumstory.com.